Hey guys, welcome to this channel. Our today's topic is from Therapeutic Exercise Foundations in Techniques book, 7th edition, from chapter number 3. And the topic is range of motion. So, for a physiotherapist, this term is very important to know. Range of motion is the basic technique used for the examination of movement and for initiating movement into the program of therapeutic intervention. Or we can simply say that the full motion possible is known as range of motion for that particular joint. There are some terms related to range of motion like goniometer, functional excursion, and how to maintain the normal range of motion. The instrument, or we can say the measuring device used to measure the ranges of available joint motions is goniometer, and it is recorded in degrees. A distance that a muscle is capable of shortening after it has been elongated to its maximum is known as functional excursion. And to maintain the normal range of motion, the segments must be moved through their available ranges periodically, whether it is available joint range or the muscle range. There are some types of range of motion exercises like passive, active, and active passive range of motion. Passive range of motion are the movements of the segment that are performed by an external force or with the help of an external force. Active range of motions are the movement of a segment within the restricted, unrestricted range of motion that is produced by the active contraction of the muscles themselves crossing that joint. Active assisted range of motions, these are the type of motions that are providing assistance for the active range of motion. For example, when someone is performing active range of motion or the muscles are performing active contraction, but sometimes the prime movement muscles need assistance to complete the motion. So, active range of motion, when assisted manually or mechanically by an outside force, it's known as active assisted range of motion exercises. Moving towards the passive range of motion, their indications, goals, and limitations. First of all, indications for the passive range of motion. It's the time when the passive range of motion should be performed. So whenever there is acute inflamed tissue, passive motion is beneficial, and whenever a patient is not able to move a segment actively, like in comatose, in paralyzed situation, or in complete bed rest, movement is provided by external source. There are some goals for passive range of motion. Like passive range of motion can maintain the joint and connective tissue mobility. Passive range of motion can minimize the effects of formation of contractures. It maintains mechanical elasticity of muscles. It decreases the pain, assists with the healing process whenever after the injury or surgery. And it helps to maintain the patient's awareness of movement, in which direction or about what degree the range of motion should be performed. So, passive range of motion can guide the patient about about the range of motion. Passive range of motion does not prevent muscle atrophy, and it does not increase the muscle strength or endurance. Moving towards active range of motion. When a segment of a body is immobilized for a period of time, active range of motions are used on the regions above and below the immobilized segment. Active range of motions can be used for aerobic conditioning programs and These motions are used to relieve stress from sustained postures. Active range of motions can maintain physiological elasticity and contractility of participating muscles. It provides the sensory feedback from the contracting muscles. It provides a stimulus for bone and joint tissue integrity, increases circulation of the blood, and thus prevents the thrombus formation. It develops coordination and motor skills for functional activities. There are some limitations for active range of motions or active assisted range of motions, that they does not maintain or increase the strength, and they does not develop skill or coordination. Range of motions should not be done when motion is disruptive to the healing process, or when there are some too much signs of or the wrong motion include increased pain and inflammation. Range of motion should not be performed when the patient's condition is life threatening. So some precautions should be taken while performing range of motion exercises, like whenever the passive range of motions can be performed, they can be carefully initiated to major joints, and active range of motions can be carefully initiated to the ankles and feet to minimize the venous stasis and thrombus formation. After the myocardial infarction, coronary artery bypass surgery, or percutaneous transluminal coronary angioplasty, active range of motions of the upper extremities and limited walking are usually tolerated under careful condition monitoring of the symptoms. These were the basics about the range of motions. For more lectures about this chapter and about this topic, stay tuned to our channel and do subscribe.